My name is Dr. Shafeena Premji. I am a family physician with a special interest in women's health. I have a clinic which opened 5 years ago, Mahogany Medical Clinic, where we provide menopausal care for women in Alberta. I also am a board member of the Canadian Menopause Society. Menopausal hormone therapy is a safe option for any woman in the perimenopause or in the menopause. The Society of Obstetricians and Gynecologists of Canada and the Canadian Menopause Society have released guidelines in 2021. The guidelines recommend that any woman who is under the age of 60 or within 10 years of their menopause are considered safe candidates for hormone therapy. Now, there are also a subset of women, those who are under the age of 40 in premature menopause, or those who are under the age of 45 in early menopause. For these women, menopausal hormone therapy is actually recommended for the prevention of osteoporosis, cardiovascular disease, and genitourinary syndrome of menopause. The most common side effects that women will tell us about are unscheduled vaginal bleeding, which is usually only for the first 3 to 6 months from the onset of therapy. We also see women talk and complain about some breast tenderness, headaches, as well as fluid retention. For those women who are also taking progesterone, oftentimes we will see some mood fluctuations, and sometimes they also will complain of some drowsiness. Is hormone therapy safe? Well, there are a subset of women who hormone therapy is contraindicated. If you are a woman with a personal history of breast cancer, if you have ever had a stroke, if you have a history of a clot in your lungs or in the deep veins of your legs, if there is any history of active liver disease, these are patients who are contraindicated to hormone therapy, and we do have options for non-hormonal therapies as well. Brain fog, lack of concentration, and body aches are most definitely symptoms of perimenopause and menopause. Fortunately, when we specifically look at brain fog, we know that it is considered a transient symptom. In terms of how to manage this, it is a multifaceted approach. So first of all, we recommend that you visit your healthcare provider to assess and treat modifiable risk factors. So things such as diabetes, high cholesterol, and high blood pressure. We also recommend that women consider stopping smoking and also consider limiting their alcohol intake. We recommend regular exercise, 150 minutes per week. And finally, for those women who are looking for something else to do, we recommend really trying to engage with the community socially, challenging themselves. So that would mean, including potentially learning a new language or learning a new skill or volunteering at a local community center. So the question you have to ask yourself is, when a hysterectomy is done, are their ovaries left in place or are they removed? If you have a hysterectomy and your ovaries are left in place, this is not menopause. This is actually just a cessation or a stopping of your menstrual periods. If a woman has a hysterectomy and both her ovaries are removed for various medical reasons, then this is considered surgical menopause. If we go back to 2002, when the Women's Health Initiative report was released, it really put a big fear of hormone therapy, both for women and for healthcare providers. When the data was reevaluated, what we realized was that the data had not been extrapolated and differentiated based on a woman's age. And so when we reviewed the data now, we realized that the data was incorrectly published initially. What is exciting to know is that over the last 10 years, there has been so much time, energy, and research into the care of the menopausal woman. As a board director of the Canadian Menopause Society, we work with healthcare professionals across the country to help educate and provide more information on how to care for these women. In addition, over the last 5 years, we've had 4 Health Canada approved products which have been released and are now available on the market to help women with these symptoms. So although, this area has been considered taboo, we are coming a long way. A lot of women, unfortunately, do also complain about weight gain in menopause. And we do know that weight gain is not considered abnormal or unusual for women in menopause. In general, women will gain around 2.5 kilograms after they go through this transition in life. We know that there is a change in the fat distribution, and this is genetically and biologically determined. We do recommend several lifestyle changes. So for example, we recommend that women focus on, decreasing simple carbohydrates, decreasing portion sizes. We also recommend regular physical activity, 150 minutes per week, and particularly 2 to 3 times a week of muscle weight lifting, because we know that when we lift weights and move and burn calories by using our muscles, it is a better and more efficient way of burning calories. We also recommend a Mediterranean diet. And in addition, we also suggest that women really focus on their sleep, because we know that women who do not sleep well do tend to gain weight more. For women who cannot take hormone therapy, this is a very difficult, challenging time for them. Very fortunately, we do have medications which are non-hormonal therapies to help women manage their vasomotor symptoms and night sweats. So first of all, we do have antidepressants. So the SSRIs and SNRIs do have some effect on hot flushes. We also have a medication called gabapentin. Gabapentin is an anti-seizure medication, or a medication we use for neuropathic pain. This medication has shown to improve hot flushes for women. We have a very old blood pressure pill called clonidine. And finally, there's a medication which has been used for urinary symptoms. It's called oxybutynin. And in the recent studies, there has been some evidence for their benefit as well for these symptoms. How do we diagnose perimenopause and or menopause? There is really no single blood test that can confirm this diagnosis. This is a clinical diagnosis. We, as a expert panel of the Canadian Menopause Society and the SOGC, do not recommend any expensive salivary gland testing or any specific hormone testing. As we know, as women go through the menopause transition, there are constant fluctuations in their hormonal levels. So really, if we were to do any kind of hormone testing, it would really just be looking at a single point in time. We therefore do not support any kind of formal testing. What we do recommend, however, sometimes is screening for thyroid dysfunction, because many women in this age do experience thyroid disease. As a family physician myself, we are your health advocate. We support and recommend health prevention and health promotion. The challenge really lies in the medical curriculum. We don't have any formal training in menopausal care and care of the women in the menopausal transition in our medical training, and residency programs also have very limited, if any, training at all. The other challenge also lies in the fact that many centers across the country don't have a formal multidisciplinary menopause clinic. So that, in combination with the continued fear about prescribing and how to prescribe and what to prescribe, is really what leads women to feel like their symptoms and their concerns are being dismissed. As a member of the Canadian Menopause Society and a board member, we as a team of healthcare providers and professionals are working really hard to close the gap of knowledge. We have a website. We've got lots of information about how to access Health Canada approved therapies and what the most updated guidelines are. So we are working hard, and hopefully over the coming years, our colleagues will feel more supported and be able to provide better care for you as a woman going through this challenging time in your life. Some of the questions you want to ask would be, are you providing menopausal care which is in line with the Society of Obstetricians and Gynecologists of Canada guidelines? Do you potentially have a NAMS certification, so a North American Menopause Society menopause certification, which is an examination that many menopause practitioners will write? And do you also prescribe therapies which are Health Canada approved? These are excellent questions you want to be asking your menopause specialist.